One of the things that I always talk to my patients about at the first prenatal visit are dietary restrictions. There's a lot of information out there about dietary restrictions, what you should eat and what you shouldn't eat, but actually especially what you shouldn't eat, that in my opinion is just frankly wrong and bad advice. So let's talk about some of these things. I think one of the big ones is caffeine. For some reason, people believe that you shouldn't be drinking caffeine when you're pregnant. The truth is there's really no data that caffeine is dangerous in pregnancy. And in fact, a lot of people have tried to prove that it is because it seems like it ought to be, and we really haven't found that caffeine causes any problems in pregnancy. There was one study that came out a couple years ago that linked caffeine to increased risk of first trimester miscarriage. However, that study was very flawed because we know that people that have more nausea and vomiting early in pregnancy are less likely to miscarry. And people that have more nausea and vomiting are less likely to drink caffeinated beverages. That was not accounted for in the original study. And when you go back and look at the study, accounting for that, it turns out that it wasn't the caffeine that was causing the miscarriages at all. It was the fact that people that had more nausea and vomiting were less likely to miscarry and therefore less likely to drink caffeine. So caffeine's fine. If you drink a cup of coffee or two, or you want to have a soda during the day, it's not going to hurt your baby. Now, the truth is, nobody should be drinking 10 Red Bulls a day, so you got to do things within reason, but that's true whether you're pregnant or not pregnant. The other thing I find is a lot of women will stop their caffeine because they read on the internet, or they hear from a friend that that's bad for them, and then they start getting bad headaches. When I talk to them and tell them, drink your coffee, their headaches go away. So feel free to have a cup of coffee or two or a soda, drink your caffeine, it's totally safe for your baby. Another thing that's often talked about is fish. Fish is an interesting problem. Fish contains some mercury, and people believe that if you have too much mercury in your diet, it can affect fetal brain development. The truth is, there isn't a whole lot of hard data that proves this, but that worry is there and it's not completely unreasonable. However, even people that feel strongly about the mercury connection between fish and baby development agree that 3 servings of fish a week is safe. The funny thing about fish is there's a lot of oils and fats in fish that actually promote brain development. So there's some benefit you get from eating fish too. So if you enjoy fish, eating fish 3 times a week is absolutely safe. I would not recommend having a tuna sandwich, 3 meals a day every day, but really you want to try and eat variety. Now the other thing that goes along with fish is sushi. If those 3 meals of fish a week are going to be sushi, that's fine. It doesn't really matter whether the fish is cooked or raw. Cooking the fish is not going to get rid of the mercury. And as long as you go to a reputable sushi restaurant, you're going to be fine. I mean, you certainly don't want to have food poisoning when you're pregnant, but then again, you don't want to have food poisoning anytime. And if you do get food poisoning, you're going to be miserable, but it's not going to hurt your baby. So that's another big one that people talk about. Other things that we see out there on the internet are things like deli meats. People will say, oh, you shouldn't eat deli meats. Or they'll talk about cheeses. You shouldn't eat cheeses. The cheese one is interesting, and this stems back from a problem years ago in the 80s with a cheese that was coming over from Mexico called Jalisco cheese. And there were some people that got very sick and some people died from that because it was contaminated with listeria. And I think that's where the holdover from cheese comes from. Now, in my opinion, it's probably not a good idea to eat non-pasteurized cheese, but that's true whether you're pregnant or not pregnant because there is the risk of illness from that. But it's not a specific pregnancy issue. So cheese that you get from the store or normal cheese is certainly safe to eat in pregnancy and you don't have to worry about it. Now deli meats also has this issue of listeria, and some people are worried that it is possible to find listeria in deli meats and they're worried that that can make you sick. What they're specifically worried about is something called chorioamnionitis. It's a big word which means infection of the amniotic fluid around the baby. And honestly, if that happens, it's a total disaster and you can lose your pregnancy. Fortunately, this is extremely rare. The problem is the bacteria that most commonly causes this is listeria. That's the bacteria they're worried about in deli meats. But most people believe that the listeria that you get the infection from in your uterus comes from listeria from the vagina going up through the cervix to invade the amniotic fluid. And so I don't know what you're doing with your deli meats, but if you're eating them through your mouth, it's very, very unlikely that any bacteria that may be contaminated with is going to get to your uterus, because that bacteria is going to be taken care of by the stomach acids. And so in my opinion, it's very safe to eat deli meats in pregnancy. My general rule in pregnancy is live your life. For the most part, you're going to be fine. Eat what you normally eat, do what you normally do. The baby is a lot tougher than you give it credit for. I mean, there are some obvious things. You shouldn't be drinking alcohol. Hang up the crack pipe when you're pregnant. Obviously you shouldn't be doing drugs when you're pregnant. and cigarettes is something that you shouldn't do as well. Now, those are the obvious things. But in general, as far as whatever you want to eat, you can eat anything you want, obviously within reason.
Medtwice.com